So hi, everybody. My name is Ana Sureda. I work in Barcelona, Spain, and it's a pleasure for me to be here discussing a little bit with you some topics regarding CAR T cells and aggressive non-Hodgkins B-cell lymphomas. So in the last ASH meeting, we saw the results, the positive results of 2 out of 3 prospective clinical trials that compared the standard of care, so chemoimmunotherapy and consolidation with autologous stem cell transplantation, with the 3 different anti-CD19 CAR T-cell constructs that we have nowadays for patients with early relapse or primary refractory aggressive B-cell non-Hodgkin's lymphoma, so basically second line. So which are the patients that would not qualify for CAR T in second line therapy? So basically, I would say that those patients that were not included in these prospective clinical trials that were positive, at least from my point of view, would not qualify for CAR T in second line therapy. So basically, patients with rare relapses were not included in these trials, and these patients can do really very well with autologous stem cell transplantation that has been the standard of care for many years. Then these trials were basically including patients, candidates or transplant eligible. So in principle, those patients that are not transplant eligible were not included in the trials, and we don't have clear demonstration that CAR T would be a best option than the standard of care in second line. And then maybe there is a third group of patients which is not so well defined that might also benefit from autologous stem cell transplantation and not from CAR T. And these are the patients that for whatever reasons, even if they are early relapse or primary refractory, they achieve a complete remission with second line chemotherapy. These patients were not included in the pivotal trials. So we really don't know which is the answer to the question, but I would say that these patients would also benefit probably from an autologous stem cell transplantation. So because of these 3 prospective clinical trials that I was mentioning before, 2 of them positive, so it means that the primary endpoint of the trial was met. And then for patients with primary refractory and early relapse aggressive B-cell non-Hodgkin's lymphoma, the event-free survival of those patients being randomized into the CAR T-cell arm was better than the event-free survival of those patients being treated with the standard of care. Most probably, we will be seeing in the near future a change in the standard of care for patients with aggressive B-cell non-Hodgkin lymphoma second line. So for many years, chemotherapy or second line salvage chemotherapy plus autologous stem cell transplantation has been the standard of care for these patients. Probably in the near future, we will be able to use CAR T cells for these patients. As I have said before, for those patients that in principle were included in the prospective clinical trials and from whom we have the information.